Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everybody. Welcome to Falling Through the Cracks. Today, I'm speaking with Michele Collins. Michele is a mom of 2 teens, school psychologist, kitten fosterer, and advocate for ovarian cancer awareness and research. Michele volunteers with SHARE's Pink and Teal program, giving talks about ovarian cancer and advocacy at corporate workplaces. Michele, welcome to the show.
Oh, thank you so much for having me.
So what got you involved with ovarian cancer?
Well, I was diagnosed with ovarian cancer February 13th, 2015, as a young mom, no risk factors or family history. And I went through a radical hysterectomy and chemotherapy, and I've been in remission for almost the last 5 years. And I wanted to kind of give back to the community and support other women going through what I went through. So I wanted to get involved with SHARE and speaking with current patients, because that's what I needed when I was first diagnosed. I actually spoke with a volunteer from SHARE about a couple months into my diagnosis, and she really helped me just get my mind in the right place and have hope. So that was my thing when I got through everything. I wanted to give back and do the same for other women.
So when you were diagnosed, you said you needed support. So how were you feeling? What actually happened at that time?
I was just in a deep, dark hole of despair. I thought I was going to die. I was really depressed. It was just really hard to cope with everything. And I kind of got myself out of it just by connecting with other survivors and other patients who had been there and who are doing well. And that's what gave me the motivation and the hope to fight.
So, I mean, I think this is common with any diagnosis. People have a processing to go through. Cancer seems to be a pretty scary one for a lot of people because it's quite unpredictable. What was your journey like as you went through treatment and everything that you did?
My doctor at one point told me she was giving me permission to be optimistic. And at that point, I decided I needed to stop thinking the worst and start thinking that I might survive and beat the statistics. And so, once I got through chemo, and I had to have intraperitoneal chemo where they put the chemo directly into your stomach. And also, I had another port where they put the chemo into my chest, so 2 different types of chemo. And that was tough, but I got through it. And the big surgery was tough. That was a radical hysterectomy, so I went into surgical menopause at the age of 39. So it was a battling of all these different side effects and symptoms of everything that was happening. But I had the support of my community and my family and my friends, and they really helped me. You really need a good support system when you're going through something like a cancer diagnosis.
Well, and chemo is not particularly the most pleasant treatment, so it's a difficult thing to go through. What was happening at that point? You had little kids. How did you find the support that you needed and rally through something that difficult?
I went online and I joined a bunch of support groups online, and I was put in touch with actually a SHARE volunteer who I spoke to on the phone for about an hour, and she just calmed me down and answered my questions and told me what from her perspective, how she got through certain things, and it just really helped. I lost my hair, I was sick, I had to have tough conversations with my kids, my husband. It was a tough time in my life, but I'm proud to say that I made it through, and I think I'm a stronger person now for everything.
And you're in remission right now?
Yes, I'm in remission, doing well. Back to my, busy life pretty much.
Which is, I think, good for people to hear. Now, with ovarian cancer, what symptoms did you have leading up to your diagnosis? Was it really obvious that there was something going on?
It was. I had one of the more sort of uncommon symptoms with ovarian. Typically, the four main symptoms are bloating, urinary urgency and frequency, pelvic or abdominal pain, and getting full quickly when you eat. It's called early satiety. I didn't really have any of those, but there are a bunch of other symptoms like back pain, menstrual irregularities, painful intercourse. The one that I did have was menstrual irregularities. My period became very watery and constant almost, and I knew something was up. I almost thought maybe I was incontinent because it felt like I was just leaking fluid. And so at first I thought I had some kind of UTI, but I didn't have any other of the UTI type symptoms like burning or urgency or anything. It was just this leakage of this fluid. And so I went to the doctor, and I actually went to a urologist thinking it was a UTI, and he did a pelvic exam and did some urine tests, and everything was normal. But he said I should go for a CAT scan because it would be uncommon for me to just develop incontinence. So I scheduled that, but in the meantime, I went to my OB/GYN because now I'm thinking it had to do with my period because it was happening around that time of the month. And she noticed the unusual fluid, and she didn't think it was urine. And so she set me up for a transvaginal ultrasound, and I had that done before the CAT scan, and that's when a mass was seen on my left ovary. So having that fluid coming out actually probably saved me, and I was diagnosed at an earlier stage than most with ovarian cancer. I was diagnosed at stage 2, which isn't so common because it's usually not diagnosed until stage 3 or 4.
Well, a lot of the symptoms, if I understand right, of ovarian cancer can be kind of brushed off as something else, which, is even almost what happened to you if you hadn't had that fluid leaking. So is it really common to have it as obvious as your symptoms were, or is it more common for it to be, something that people will just think is, part of life or something else?
Yeah, that's the problem with ovarian cancer is a lot of the times their symptoms are so common that, people do brush them off, and doctors do brush them off. They're, told maybe they're stressed out or they're going through menopause or they have irritable bowel syndrome. They go to different specialists, and the diagnosis gets delayed. But, the medical community did decide that there are definitely symptoms that doctors and women should be aware of that can indicate a possibility of ovarian cancer, especially if they're new for a woman, never had these types of symptoms before, and they're lasting for a couple weeks. You should definitely get it checked out. And especially if you also have a family history.
Now, you said that you didn't have a family history or genetic component to this. Is that a very common relationship with ovarian cancer?
Yes, actually, about 10 to 15% of women do have a family history, and those are out of the diagnoses of ovarian cancer, about 10 to 15% have a family history, but more like 85% don't. So, if you do know that it does run in your family, you should just be extra aware, but it can really happen to anybody.
Well, yeah, 15% isn't a lot. And now there's a lot of talk about genetics as well, especially with breast cancer and ovarian cancer. Is there a huge link there that we understand, or is that something that we're still looking into?
Yes, there is a link with breast cancer. It revolves around the BRCA1 and BRCA2 mutations, which can predispose a woman to a higher risk of breast cancer as well as ovarian cancer. So if breast cancer runs in your family at an early age, usually if someone's diagnosed before the age of 50, that could indicate a possibility of a mutation, and that mutation would also impact a woman's chances of developing ovarian cancer. So if either breast cancer or ovarian run in your family, you should just be on a little bit of a higher alert.
And so with that, I mean, the genes were made famous by Angelina Jolie when got her breasts removed because she had that gene and she was just being cautious. Is that something that people do a lot? Do they just check into ovarian cancer?
Actually, Angelina Jolie brought a lot of good attention to the mutation and the prophylactic surgery. She also did have her ovaries removed. And, it depends. It's a personal thing. Some women who know they have the mutation might choose to have the surgery done. Some might choose to be monitored closely. It's sort of a personal decision and where they are in their, life. They are finding out that they do believe ovarian cancer might start in the fallopian tubes and spread to the ovaries. So they're doing a trial right now in women who know they have the mutation. They can choose to just have their fallopian tubes taken out, and then when they're ready for have their ovaries taken out, delay that procedure, maybe 5-10 years, so they don't go into early menopause. And they're trying to determine if that's a safe alternative to taking out both the ovaries and the fallopian tube, since going into surgical menopause at a young age can have a lot of quality of life issues. So they're trying. So far, there haven't been any cancers that have developed as the result of waiting to take out the ovaries. So that's like sort of the research that's going on right now.
Well, that's an interesting development because then, it might, if it starts in the fallopian tube and you can keep your ovaries, I mean, we know without your ovaries, you are going to go into menopause as you did. And that is extremely uncomfortable. And if this is at a really young age, you're going to be tired and you're going to have all sorts of symptoms leading up to that. So if we can save lives and then keep that quality of life, I think that's definitely a step forward.
Yes, definitely.
So now, how is ovarian cancer diagnosed? Like, you had the ultrasound done, but was there anything else that happened to confirm what was going on?
Yes, they did a blood test called a CA-125. It's a tumor marker for ovarian cancer. So in a combination between the scan and the blood test, it showed a high likelihood that the mass that I had was cancerous, but there's no way to biopsy it. You have to actually take out the entire ovary. So the only way to diagnose it is to have your ovary removed. And typically what happens is they test the ovary while you're still under anesthesia. And if it is malignant, they will then proceed with a radical hysterectomy, and it's called debulking surgery, where they then go in and take out any cancer they can see or feel. But there's really no early screening test for ovarian cancer. A lot of people think a pap smear tests for all gynecological cancers, but it doesn't. It only tests for cervical cancer, where the doctors are busy trying to come up with a screening test for ovarian, but it's sort of been the holy grail among the medical community. We're hopeful that something will eventually come out, but so far the best thing is just for women to know the symptoms and be aware of anything new that happens with your body and go to your doctor and have it ruled out, which is usually they will do an ultrasound and then proceed with a CAT scan if something comes up on the ultrasound, as well as combining that with the CA-125 blood test.
Which I think is pretty valid. And, the symptoms aren't always obvious, so it must be really difficult. I think I've done shows on women's health and how women are kind of shuffled around in the healthcare system. And I know a lot of women feel uncomfortable, especially if it's a symptom that they feel might not be serious, and they're uncomfortable, even making it look like they're complaining about something and approaching their doctor. And then if their doctor does also think it's not serious, I think this seems to be a reason why this could be delayed in diagnosis.
Yes, that's exactly what happens. The women are brushed off, or it's delayed. The doctors don't take them seriously, and that's a big problem, because a lot of women then are diagnosed at a later stage when it's harder to treat, and that's why the survival rates are are not as good as we want them to be.
Which, thank you for bringing the awareness to this, because I think it's important for women to know and to advocate for themselves. I think we're really good at knowing that something is wrong, but we can get kind of caught up in either our own little voices or the voices of other people telling us that, it's not as serious as we think. But we know our bodies, and I think we're really good at navigating what's healthy and what's not, and when we need to seek out help. So as long as we can find that trust in ourselves, we can continue to, seek help until we get, everything looked into and find what we need.
Yes, definitely. Yeah, we have to put ourselves first. A lot of times we have kids and we're busy and we're focusing on them. And if they're sick, we're bringing them to the doctor. But, everything's going to fall apart once we get sick. So we can't let it get to the point where, it's a huge deal if we could catch stuff at an earlier stage and take care of ourselves. That's what we need to do for the safety of us and our families.
Well, exactly, because if you hadn't been your own advocate and you might not be here for your children now. So it's important to think of it that way for sure. We're going to take a quick break. We're talking today with Michele Collins, and we're discussing ovarian cancer. We'll be back shortly.
Become our friend on Facebook. Post your thoughts about our shows and network on our timeline. Visit facebook.com/Voice America.
Can you truly expand your possibilities beyond what your normal capabilities are? It's very possible when you can know more, do more, and be more. Tune in each week to Shift Happens with host Karin Weary and co-hosts Ida Serena Lee and Jessica Durrell. The world is waiting for you to show off your unique gifts. It starts with healing yourself mentally, emotionally, physically, and spiritually. Once the scars of our past are gone, we can truly begin to shine. Listen live every Tuesday at 2 p.m. Eastern Time and 11 a.m. Pacific on Voice America Health and Wellness.
Sometimes it just seems that nobody understands. There's one individual who can help. If you're living with somebody who faces challenges such as autism, Asperger's, or other exceptional needs, you'll want to tune into Solutions and Strategies with Dr. Sean, Living the Challenge. Together, we'll uncover a variety of solutions to the challenges faced by individuals, their families, and teachers. Listen live every Thursday at 8 a.m. Pacific, 11 a.m. Eastern, on Voice America Health and Wellness.
When a woman is diagnosed with breast cancer, it's probably the most frightening thing that's ever happened to her. Friends and family often don't know what to do for support, not to mention the patient herself. That's where Breast Friends Cancer Support Radio comes in. Join Becky Olson, breast cancer survivor and advocate. She helps by providing inspiration, information, and most of all, hope. Tune in every Wednesday at 9 a.m. Pacific Time, 12 noon Eastern Time on the Voice America Health and Wellness Channel.
Healthcare has been a major part of news stories today, with one thing that has been consistent: inconsistency. Both healthcare providers and patients have to work around and get used to a constantly changing set of rules and issues. Nurses have historically been left out of this decision-making. Listen to Once a Nurse, Always a Nurse, Exploring the World of Nursing with host Leanne Meyer. Health professionals, we invite you to share your ideas and experiences while listening to experts in various areas of nursing. Listen Mondays at 1 p.m. Eastern, 10 a.m. Pacific on Voice America Health and Wellness.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings at the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our timeline. Just go to facebook.com/Voice America or search for Voice America.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
My co-host Oliver is a 7-pound Chihuahua cross, and he sits through all my shows with great puppy patience. He was super happy when I came home with Carbona Pet Stain and Odor Remover, which is an oxy-powered formula with active foam technology, and it is engineered to permanently remove pet stains and odor. Carbona is a household brand. They've turned their decades of cleaning experience into products that get the job done fully, quickly, and easily. Although he tries his best, Oliver sometimes does have accidents. I pulled out the Carbona Pet Cleaner, and voila, we were stain-free and clean. It was easy to use, pet-safe, and hassle-free. The built-in 2-in-1 brush top tackles stain at the surface and deep in the carpet fibers. It is now my other best friend. Use code FTTC at carbona.com to save 20%. Happy cleaning. Hi, everybody. Welcome back. Today we're talking with Michele Collins, and we're discussing ovarian cancer. So Michele, what is the SHARE program that you're involved in?
So SHARE was started about 4 years ago by a doctor, actually a breast cancer doctor, who thought women needed support from other women who were going through a cancer diagnosis, and then it branched off into ovarian cancer, and we have just a bunch of different support groups for even Latina, ovarian, metastatic breast cancer, early stage breast cancer. We have support groups. We have a helpline where women can call in any time of the day, and we can match them with a patient that is in their was in their similar situation and provide support over the phone or in person. We have webinars that are you can sign up for that are hosted by social workers and doctors and gynecological oncologists, just to educate women on what's going on, clinical trials. It's just a wonderful support program for women who are going through ovarian or breast cancer, and caregivers as well. We have caregiver support programs where a caregiver can speak with another caregiver to get support. We can't forget about the caregivers. They need support as well.
Oh, I definitely agree with you on that. I'm glad you're including that. One of the first shows that I did, because I focus on Lyme, that's part of my story, but I did a show just on caregivers. And, it doesn't matter what the illness is. It's very difficult to watch somebody that you love suffer and be there for them, as well as take care of yourself and your family and do everything that you need to do. And I think that part gets forgotten a lot. That, the caregivers are just in the background, and it's not really about them, but they do need that support. So I'm glad you're including them for sure.
Yeah, definitely.
So if somebody's wanting to access SHARE, or they just get a diagnosis, what would happen?
They could call our toll-free number, 844-ASK-SHARE is the number. Or they can go online to sharecancersupport.org, and we'll put you in touch with the right person.
And so how do you determine that? Are you putting patients in touch with survivors just so that they can have that kind of conversation, or what happens?
Yeah. Whatever. We have in-person support groups where they can come into New York, and we have some across the country as well. Or we have phone support, or we have webinars on the web support where they can attend meetings online pretty much. So it's up to the patient what they need. We can direct them to all the resources that we have, and whatever they're comfortable doing. It's up to them.
Oh, that's pretty amazing. I think, we need more of this kind of support for everything that happens. I know it's, I don't know if this is how you felt at the time you were going through it, but a lot of people when they're ill, they feel very isolated, scared and angry and all those sorts of things. But I think isolation is one of the major things that I see when people are ill that is the hardest to get over, is that something that you Yeah,
I definitely felt that way. I especially being younger and getting this diagnosis, I felt who wanted to meet people who had gone through this at a younger age like me. I ended up reaching out to some moms in my town who I knew had gone through cancer, not ovarian, mostly breast cancer, and we ended up meeting every month for like a breakfast club. Then I got involved with, SHARE, and I went to the Ovarian Cancer Alliance conference. They have one every year in July, and I met other survivors, and just developing that cancer community helped me so much. And it's unfortunate, but we have to sort of do the work to make that community for ourselves, because it's hard the doctors are busy, curing our cancer and treating us, that there's really not that type of emotional support through the doctors. We need patients who have been through it to guide us a lot of the times, and that's sort of what helped me the most, honestly.
So was there any tips or advice that you got speaking with other people that was really helpful for you?
Yeah, it was, don't stay off the internet, only go, which is hard to do, but go to reputable websites like SHARE or like American Cancer Society. Don't read sob stories and blogs, and try to avoid that stuff, because everyone's situation is different. Take everybody's support if they want to give it. People want to help, so don't say no. A lot of times we're used to doing everything ourselves, but accept people's help. Rest when you need rest. When I was going through chemo, it was eat whatever you can eat, just to eat. Don't worry about being, juicing or any crazy things. Just eat what you can eat. Because the most important thing was just to eat. What else? I guess those are my top ones that I remember.
Well, I like the internet one. I think this is important when you're going through anything. The internet has given us some power, because people can, find some solutions in that way. But I know that it can become quite addictive to continue looking. And as you said, reading sob stories or reading those negative blogs can set your mind up for failure. When, if you didn't read those, you might at least feel better going through your journey, or be less obsessed with, doing all the little things that you're reading about that, worked for somebody but may not work for you.
Right, exactly. And, you definitely can get swept up in those stories. And even now, I still will read one every now and then, and I have to, just think, this isn't me. I'm in a good place right now. I'm going to, hopefully I'm going to be okay. It's really easy to fall into a spiral of worry and fear and all of that. So you just have to be mindful when you're online.
Yeah, definitely. Now, with the ovarian cancer, aside from the genetic component, do we understand what is causing this?
It's not really. It's really just your cells going rogue, I guess, in your body. There's no specific cause. There are risk factors, such as being older, being overweight, never having children. They think that it's related to your body producing estrogen and your eggs. Anything that will stop your body from producing that estrogen, or from making the egg, pretty much. So, like when you have a baby, your body shuts down. You don't produce the egg. When you're on birth control pills, that can reduce your risk. And obesity is a risk factor because fat cells produce estrogen. So they think it has something to do with estrogen. But there's really no just a definite hypothesis with this is why it happens.
Well, yeah, because I think what seems to happen is there might be multiple causes. The genetic cause might be estrogen. There might be just something else. So it might be a little more complicated than, one thing being the cause that we can just solve and test for.
Right. Yeah, it's a very complicated disease. They've found that even amongst women with all the same type of ovarian cancer, their tumors are so different, and it's just a very complicated disease.
Mm-hmm. So now, if they're suspecting that estrogen might be linked, is hormone replacement therapy, does that put women at a higher risk?
Yes, that is a risk factor. They do think it might be linked.
Okay, which is interesting because that is something that people navigate towards when they're, going through menopause or uncomfortable, and it's supposed to make our lives better and more comfortable. But interesting that it also puts us at risk of cancer.
Yeah, it's a slight risk. I don't want to freak everybody out, but it's a slightly increased risk.
Okay. And now, is that just the synthetic hormone replacement therapy, or does that include bioidentical hormones? Do we know that?
Does it include what?
Bioidentical hormones, which is a little bit different.
I'm not sure about that.
Okay. And now, one thing that people have always talked about is talcum powder causing an issue for women's health. Is that true, or is that a myth?
There is no conclusive evidence that talcum powder is a risk factor. They've done a lot of studies about it, and they just can't definitely link it. All the doctors I've spoken to have not said that they believe that it's a risk factor. Okay. But would I use it now? I don't use it now.
Just too scared if I take that risk, right?
Right. I mean, if you could, or use cornstarch powder instead of talc.
Right.
Just to be safe, because why, even though there's no definite link, it's something you can modify, so why not?
Yeah, exactly. Now, with there being a possible hormone link to ovarian cancer, there are a lot of women's conditions that could, be related. I'm just wondering if endometriosis is a risk factor.
It is, actually. That is a risk factor specifically for a subtype of ovarian cancer called endometrioid ovarian cancer. They have found that some women with endometriosis will develop endometrioid ovarian cancer.
Okay. And so because often I find women with endometriosis are diagnosed, and then if their pain isn't severe, they're just sort of not even monitored a lot. This might be in Canada, but is there something that women can do in that situation to make sure that they're protected in that case?
I would just advocate. I didn't have endometriosis, but I would just, if I did, now knowing what I know now, I would ask my doctor maybe for periodic ultrasounds or maybe a periodic CA-125 test just to get a baseline, or, especially if you end up having pain or concerning symptoms, it's definitely something to just bring up with your doctor and see if you can come up with a plan.
I like that you said getting a baseline. That seems to be, that's a really good idea, because then you know what things should look like. So if you're having symptoms and things have changed, then you know that there's something going on, as opposed to, this could have been there for 10 years.
Right, exactly. I think that's important to know. Actually, I don't carry the mutation. I was tested, and I don't have any of the mutations or endometriosis or anything, but I told my sister, make sure your OBGYN knows about me and get a baseline CA-125 and ultrasound for yourself, just so you know if you ever develop concerning symptoms that this is something new, and just, it's good to have that information.
Yeah, exactly. Now, what about women can get cysts on their ovaries? Is there a relationship there?
Cysts, women develop cysts. It's common to develop cysts, but if it's after menopause and you develop a cyst, that's more concerning, because you shouldn't be developing cysts once you've been in menopause. So that would be sort of a red flag. And any cyst, even at a younger age, should just be monitored, make sure it's not growing or changing. And, a woman can just talk about that with her doctor about the schedule or how long you should monitor it to make sure it gets smaller and it doesn't change is the most important thing.
Okay. And with what you went through, you said they saw something in an ultrasound, and you mentioned as well that they're not always sure if it is cancer until they go in there. So can cysts look like cancer, or do they look different in the scans and there's an obvious difference?
Yes, the radiologists can tell the difference between a concern, like a cyst that looks more like a mass or a cancer, and a simple cyst. Maybe that just filled with fluid. So if the cyst on the ultrasound is solid, or there's a lot of blood flow that goes through it, or it's irregular, if you have ascites, which is fluid that develops in your abdomen, which can be seen on a scan, those are all red flags, which would make you more red flag 2, then pursue this. And if there is a concerning cyst, you should see a gynecological oncologist. But any surgery for any gynecological cancer should not be performed by your OBGYN or a general surgeon. A gynecological oncologist is a doctor who specializes in cancer and knows how to do an optimal debulking, which is what it's called. They know where all the cancer tends to hide, and they're trained in getting it all out. Women who have their first surgeries done by a gynecological oncologist have better survival rates. So it's really important to seek out a gynecological oncologist if there's any suspicion that you have ovarian cancer or any other gynecological cancer.
That's good advice. We go to the specialist so that they can help us. Now, is that not? Do women not get referred to a gynecological oncologist all the time? Is that something that we have to advocate for?
Hopefully, your OBGYN would know to do that, but sometimes that isn't the case. Sometimes women do have their first surgeries done by their OBGYN, or maybe it was an unexpected finding that they found something. They were in for some other procedure and cancer is found. Women should then proceed to a gynecological oncologist, and sometimes they actually have to have a second surgery done in those cases so that the gynecological oncologist can go back in and make sure everything that they can get out is out. It is sometimes women don't have their first surgeries done by those specialists. So, it's important to spread the word with that you want your first surgery done by, and any surgery after that, a gynecological oncologist.
Okay.
And in rural areas, there aren't as many as, urban areas, like big cities. Like in New York, we have tons, but some places in the Midwest don't have any. So you might have to travel, which is a factor.
For sure. Okay, we're going to take a quick break. We're talking today with Michele Collins, and we're discussing ovarian cancer. We'll be back shortly.
Become our friend on Facebook. Post your thoughts about our shows and network on our timeline. Visit facebook.com/Voice America.
Can you truly expand your possibilities beyond what your normal capabilities are? It's very possible when you can know more, do more, and be more. Tune in each week to Shift Happens with host Karin Weary and co-hosts Ida Serena Lee and Jessica Durrell. The world is waiting for you to show off your unique gifts. It starts with healing yourself mentally, emotionally, physically, and spiritually. Once the scars of our past are gone, we can truly begin to shine. Listen live every Tuesday at 2 p.m. Eastern Time and 11 a.m. Pacific on Voice America Health and Wellness.
Sometimes it just seems that nobody understands. There's one individual who can help. If you're living with somebody who faces challenges such as autism, Asperger's, or other exceptional needs, you'll want to tune into Solutions and Strategies with Dr. Sean, Living the Challenge. Together, we'll uncover a variety of solutions to the challenges faced by individuals, their families, and teachers. Listen live every Thursday at 8 a.m. Pacific 11 a.m. Eastern, on Voice America Health and Wellness.
When a woman is diagnosed with breast cancer, it's probably the most frightening thing that's ever happened to her. Friends and family often don't know what to do for support, not to mention the patient herself. That's where Breast Friends Cancer Support Radio comes in. Join Becky Olson, breast cancer survivor and advocate. She helps by providing inspiration, information, and most of all, hope. Tune in every Wednesday at 9 a.m. Pacific Time, 12 noon Eastern Time on the Voice America Health and Wellness Channel.
Healthcare has been a major part of news stories today, with one thing that has been consistent: inconsistency. Both healthcare providers and patients have to work around and get used to a constantly changing set of rules and issues. Nurses have historically been left out of this decision-making. Listen to Once a Nurse, Always a Nurse, Exploring the World of Nursing with host Leanne Meyer. Health professionals, we invite you to share your ideas and experiences while listening to experts in various areas of nursing. Listen Mondays at 1 p.m. Eastern, 10 a.m. Pacific on Voice America Health and Wellness.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings at the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our timeline. Just go to facebook.com/Voice America or search for Voice America.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Michele Collins, and we're discussing ovarian cancer. So, Michele, when somebody goes through treatment, I know, we've talked about surgery and a little bit of chemo. Is there anything else, or what would be the most common process for somebody to go through after diagnosis?
To find support, you mean?
No, for treatment for their cancer. Is there something is it a common thing? Like, does everybody get surgery and chemo, or does it vary depending on what you have going on?
Yes, with ovarian cancer, typically everybody gets surgery and almost everybody gets chemo, even a lot of cases when you're diagnosed at stage 1, because there's a lot of times microscopic cells, even at stage 1, that might have spread throughout your abdomen. So, like if the tumor, if you're diagnosed at stage 1C, for example, that would mean that there was maybe a rupture of the tumor, and they want to make sure you mop everything up with chemo after that. So typically, yeah, and radiation is sometimes done for certain types of ovarian cancer, but it's not done commonly, because a lot of the times ovarian cancer is more widespread, and radiation has to focus on a targeted area, so they don't typically do radiation for ovarian cancer, only in like certain situations.
Okay, and then aside from that, what sort of follow-up do women have? Are there medications? Are they monitored at a certain period?
There are, actually, the last couple of years, they've come out with some new treatments with, they're called PARP inhibitors, and also a drug called Avastin, which is sort of a maintenance drug. And there are now drugs that women are taking for a couple of years after they're done with their chemo to see if it can delay either a recurrence or keep them in remission. But I didn't take any of those drugs because at the time I was diagnosed, they weren't available. And at this point, I'm too far out to go back and go on something. But there have been a lot of advances in the last few years with drugs to try to keep women in remission that are helping.
Oh, that's encouraging.
Yeah, and we get monitored obviously with CT scans and blood work over the course of your life. Pretty much the rest of your life, I'll be monitored.
Okay. And is there a certain point where they would monitor you less? Is there a certain point where you can go, okay, I'm out of the danger zone, and, they would maybe check less often? Or is it always the same risk?
It depends on your gynecological oncologist. Mine likes to follow her patients for life. So after 5 years, she told me that my risk drops a little bit for a recurrence, but you're sort of never out of the woods. I've read studies where if you haven't recurred at 12 years, that is a good indicator that you might be cured, but you really won't know until, the end of your life what you're going to die of. I know it sounds morbid, but there's really no guarantees that it won't come back.
Mm-hmm. So how did you feel with that knowledge? Are you afraid of a recurrence, or have you reached some sort of peace about what's happened?
Surprisingly, which I never thought I would be this strong before I was diagnosed with cancer. I always just feared cancer. It's weird. I had this sort of fear of it. And I thought I would crawl into a hole and not be able to function, but I don't know. There's a term called post-traumatic growth, where you go through something so devastating that you actually come out of it a stronger person. And I do live almost a happier life. I know it sounds crazy, but I live every day, and I'm happy to be here, and I'm grateful. And I do a lot of volunteer work, which kind of fills my heart and soul. And I take care of myself. I do a lot of self-care. I try to keep my stress down. I kind of live, I'm okay with it. I've made peace with the fact that if it comes back, I'll go through treatment again. Hopefully I'll be in remission for a long time. I have a positive outlook, even though, the disease has been known to come back. But I have a lot of factors in my favor that I always repeat in my head when I start to kind of worry about a recurrence. Takes a lot of kind of like mental gymnastics, though.
Well, for sure. Now, how old were your children when you were diagnosed?
They were 8 years old and 10 years old.
Okay. And how did they handle the diagnosis at that time?
They were good. They were strong. My daughter was 10. My son was 8. I actually expected my daughter to take it harder than my son, but my son ended up taking it harder than my daughter. But I've always been open with them. I never hid anything from them. They made it through. I tried to get them to go to a art therapy group at a local hospital for children of parents with serious illnesses, but they weren't interested in that. But they have a good support system. They have us, family, friends. They know all the advocacy and stuff that I do now, and it's sort of just our new normal. As far as I know, they don't worry so much excessively that they're in a bad place.
Well,
they're happy kids.
That was going to be my next question is, how are they dealing with it now? You've been in remission for 4 years, but there can be a fear, especially with anybody really, not just children, but to know that, mom could get sick again. And, I think it's a process in families to, as you said, you didn't hide anything, which I think is really good. So you're open about what was happening, and I wonder if that also makes them trust the process more, because they understand what's happened and they know that, they're going to be in the loop of what's going on. Yes. Yeah.
I didn't want them. Another thing I wanted to tell them that there is a possibility it could come back, just because if it does come back, I didn't want them to be like, but you told me you were cured, you told me this. And so I've always been open with them, and I think that's important, because they were at an age where they can understand and deal with it. There was a one day when my son came home from school, and they had learned about cancer in health class, and that it's serious and that you could die from it. And I could tell there was something wrong when he came home from school, and he started to cry, and he said, they told us you could die from this. And I said, well, you can, but you can die from a lot of things. And right now I'm doing well. And I just listed all the positive things in my favor, and that I was being treated by the top people, and I was going to do everything I could, and that seemed to calm him down.
Yeah, well, I think it's important to have that openness with everybody around you. You can get more support, but also just the understanding of where everything's at, especially for children. It's confusing anyway. Life isn't the same. But I like what you've done now of post-traumatic growth is a really good term for it. But it seems like you've embraced things quite well, and I think that's an important lesson for anybody who's gone through a chronic illness or still is, that this is what life is. It can be hard. It is hard, and we have to make the best of what we have.
Yes, and you're not alone too. There are a lot of people going through this, and that's another thing why I'm so sort of open about it, because it's important to know you're not alone and to reach out and help other people who are going through it as well.
Mm-hmm. Now, if we were to look into the future for ovarian cancer, what changes can we see that might be happening or coming in?
Well, hopefully we'll have an early screening test. That would be a huge discovery.
Yeah.
Better treatments, maybe treatments it's becoming more of a chronic disease, which is good because it used to sort of be known as the silent killer sort of death sentence. Now it's not, we're moving away from that. We're moving it into this can be managed. You might have to go back on chemo every few years, so we can make this work. So that's the direction we're going in, and hopefully any new drugs that are developed, which we need funding for because it's considered a rare disease. So unfortunately, we don't get a lot of money. That's why there's a lot of, it's important to have grassroots efforts to raise money for clinical trials, and so we can have more discoveries and saving women's lives and prolonging women's lives.
Mm-hmm. So if it's considered a rare disease, how many women are diagnosed every year?
It's about 21,000 women are diagnosed, and 14,000 deaths every year.
Oh, it might be rare, but that's still a lot. I think 14,000 deaths, 14,000 women, right? Who are, there definitely needs to be a change. As you said, early screening, so that, there might be 21,000 diagnoses, but less deaths would be nice.
Yeah, it's actually, 22,530 are the amount of women. So yeah, that's a little bit more. But less deaths would be definitely where we would want to be.
Yeah, I definitely agree. So if anybody needs more information or they need the support, how can they get a hold of the program?
So just by the number 844-ASK-SHARE. You can call that number, or you can go online to sharecancersupport.org, and you can find everything on our website.
Okay, perfect. Now, do you have any last advice for anybody who is newly diagnosed or whose partner or family member is?
It's keep hope alive. This isn't, you can do it. What else? September is Ovarian Cancer Awareness Month, where our color is teal. Get involved also with patients, other survivors and former patients. Reach out. Don't be afraid to talk to people. It really helps to talk to someone who's been through it.
Mm-hmm, for sure. Well, Michele, thank you so much for joining me today and all the work that you do to bring awareness and help women with this disease.
Oh, thank you for having me. I really appreciate it. It's been my pleasure.
And I want to thank everybody for listening. If you want more information about my story and what I went through back to health, you can see that on my website at dr-risk.com. Don't forget to follow me on Facebook, Twitter, or Instagram. If you have any questions, you can send them to anantacalgary@gmail.com. Thanks so much for listening. Be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness Channel. We'll talk more next week.